For melanoma patients, which symptoms or immune-related adverse events would you like to highlight and why? So in the setting of melanoma, I think that we are ahead of the curve and we have approvals in the adjuvant setting. And this is a really interesting thing. We've been talking about immune-related adverse events for several years now as we've administered immunotherapies to our melanoma patients. However, in the adjuvant setting, that conversation changes. Some of the risk that we think is quite tolerable in the metastatic setting may be much less tolerable in the adjuvant setting. So, for example, there was a recent case report of a patient who received adjuvant ipilimumab, and that patient unfortunately developed a digital vasculitis. Despite all efforts to reverse this toxicity, they were unable to do so, and this patient lost several of their fingertips due to the digital vasculitis. So in the metastatic setting, that may be an acceptable risk or may not be, but in the adjuvant setting, that's really scary. And then there's other immune-related adverse events that are, of course, much more common, such as the endocrinopathies. You know, the thyroiditis, we have not seen that really reverses, and the same with diabetes. And so if you're starting a patient on adjuvant immunotherapy in the melanoma setting, this conversation has to be really thorough in terms of the risks and the benefits, because the benefit is not as clear with that patient population. Additionally, a lot of times in the adjuvant setting, these are patients that may potentially still be considering having children, and we don't have a lot of good data about immunotherapy and how it affects fertility. And so it gets a lot more complicated. So be sure that you are spending the time to talk about a thorough risk-benefit analysis with your patients in the adjuvant setting before you start them on immunotherapy.